managers from the NDA, SASSA and the Department of Social Development. Today marks day 259 of the National State of Disaster, and we're at alert level 1. Recently, Minister Mkhize announced that we're on the second wave, and this is in line with the criteria that was laid down by scientists and the modeling team. Yesterday, our numbers increased to 8,166 new infections, bringing the total positive cases identified to 836,764, and this brings the total deaths to 22,747. And of course, the peak age is now mainly between 15 and 19. This media briefing is a different media briefing in that it brings together all MECs of social development. And normally the Minister and the Deputy Minister would convene the briefing, but in this case, you have all the MECs, including the CEOs, and it seeks to do two things in the main. It seeks to provide members of the public and stakeholders with a comprehensive overview about the work done in the DSD sector by the portfolio. When we say the portfolio, we say the NDA and SASSA inclusive. The challenges that confront the portfolio, those that have been in the media in the main, and it speaks to the interventions and plans to address these. It also provides journalists and members of the public the opportunity to engage with the MECs and the Minister and the CEOs. We thus anticipate that this briefing will allow the citizens of this, will allow members of the public to better understand the work of the portfolio and to ensure that members of the public are better informed of the services of the portfolio. The format of the briefing will be as follows. The Minister will provide a statement, will read the statement rather. Thereafter, we will take questions from both the media that is in the House and those that are online. And we will then get the MECs and the HODs who are in the House and the CEOs to respond to those questions. We hope to conclude by 11:15, 11:30 at the latest. And on that note, let me welcome to the podium the Minister of Social Development, the Honourable Minister Lindiwe Zulu. Thank you very much.
Thank you very much. Are you okay, guys? You done? Okay. Thank you very much. A very good morning to those that are in the room today. We try to make sure that we do the social distancing. Please keep your masks on and don't put them under your chin, tabani. And just make sure that you keep the social distance in the best way that we can. The people that we are serving need us to continue serving them. So we need to do the best that we can to keep protecting ourselves. So all MECs who are present here from all the provinces, media, they are sitting right in the front here. And may I also suggest that if in case you've got questions that you might want to ask specifically directly to the MECs, please feel free to do so. It is for this reason that the MECs are here, and the HODs also are also here, because we are a team. We are a social development portfolio. We are working very close with each other. We are holding each other accountable and also ensuring that the services that we give to our people as a social development portfolio, all the people who are responsible at that level of MECs and HODs are here too. I also do want to indicate that we are here because we will be having our MEC, which is the meeting between the minister, the CEOs of NDA and SASSA and the HODs. We will be having this meeting when we leave here, because for us, we are here to find solutions to the challenges that we face. That's the reason why we have to keep on communicating effectively as we possibly can. So to all the MECs who are here, thank you for taking the time and coming here, because I know it's not easy to get out of home. We've been working from home most of the time, but I know that ourselves, we can work from home partly, but in the main, we've got to be out on the streets and doing what is expected of us. The last weekend, for instance, we were in the Northern Cape, and MEC Nontobeko Vilakazi is here, who was with us in Calvinia. We reached out to the people of Calvinia. So a very good morning to you all, and I wish to thank you for joining us for this briefing that seeks to provide you and the public with an update on the DSD portfolio response, which form part of the government's measures to mitigate the impact of COVID-19 pandemic, especially amongst the most vulnerable. Ngicela ukusho ukuthi kunina enisemakhaya, ngila namhlanje nama MEC wama province, ngila namhlanje no HOD bama province, ngila namhlanje no CEO we SASSA, umem Totsie Memela Kambula. I think abaningi baziwena kakhulu than anybody else. Ngila no CEO we NDA Thamo Mzobe, sizokhulumisana si department ye social development ukuthi sisebenze kanjani kule period le ebhlungu esaqhubeka namanje, ngoba ikakapheli. Sicela ukusho emakhaya ukuthi siyanicela nje nizame ngako konke okusemandleni wenu ukuthi the increase esibonayo manje, ngoba uminister uZweli Mkhize ekhulumile nani, siyayibona le increase. Ngicela sibone nje ukuthi abantu bayashona, ngicela sibone nje ukuthi kufuneka senze everything to prevent the increase on the infections as well as the deaths. At the peak of the pandemic, the DSD portfolio witnessed a growing demand for social protection services in the form of income support, food relief, shelter, as well as psychosocial services, including care and support services for persons with disabilities, amongst others. The lockdown period presented additional challenges to vulnerable individuals and households, many of whom were already struggling to meet the basic needs prior to the outbreak of COVID-19 pandemic, and therefore disruptions in livelihoods occasioned by sudden loss of income and unemployment meant that a new group of people were facing undue hardship and had to be added to our social protection system. But of course, we had to respond as quickly as we possibly could, so that labo abalahlekelwa imisebenzi nalabo ababeqhubeka nje bona besebenzela imindeni yabo bezithola this time around bengasakwazi ukuyenza lonto leyo. So uhulumende siye sabona ukuthi ake sibone ukuthi yini into esingayenza ukuze sibancede. As honorable MECs present here will attest, responding to the scale of pandemic has been a challenge like no other. But I'm pleased that the portfolio is adapting and we are re-engineering our services to ensure that we respond with agility to the felt needs of our people. The human cost of this pandemic remains unacceptably high, as the country now recorded over 22,000 deaths. Our workforce, with which remains in the front line has not been spared, with 1,743 confirmed infections and 36 deaths. Once again, we wish to express our deepest condolences to the families of the departed social professionals and many other families across the country who have lost their loved ones. In the midst of this pandemic, we have become even more acutely aware of the incredible contribution that social service professionals make to the well-being of our nation. We thank you for your dedication to service and humanity during this challenging time. And I do want to say that I think the whole world is looking at us as South Africa, and there's many lessons that are going to be learned from how we were able to respond to the challenges, not only as government, but also civil society, as well as community-based organizations who stood up and said, even though we know the pandemic is somewhere there, we don't know exactly where it is, they got up, wore their mask, kept the distance, and went to our communities to communicate. We are greatly concerned that over the last few weeks, the country has recorded a surge in the number of new infections. The stark warning by my colleague, the Minister of Health, Zweli Mkhize, about the second wave of the pandemic is already underway in 4 provinces with devastating consequences. As we head into the festive season, we urge all South Africans to stay safe by following all COVID-19 protocols, such as wearing the mask, washing your hands with soap or alcohol-based sanitizers, and observing social distances at all times. When you do so, you're not only saving yourself, you are only saving the people around you and the people that you say you love and you care for. Just like we work together during the outbreak to flatten the curve, we do all that we can to prevent further spread of the second wave of the pandemic. And Program Director, allow me now to briefly highlight some of the key policy responses we are currently implementing as a portfolio. And I remind us again, the portfolio is the Department of Social Development, is SASSA and NDA. And may I add also that we know the South African Council for Social Service Professions is also a part of us. I hope that they are here if in case there are questions that needs to be answered by them. I deal firstly with early childhood development and partial care facilities. The value of early childhood development, ECD, and partial care facilities has never been more evident than during this time. For this reason, we are working with the sector through the intersectoral forum following to address a number of challenges confronting this sector. These include the allocation of a stimulus relief package of over 5.8 million by the National Treasury for unemployed risk support to 108,833 ECD-related workforce. This allocation will also support massification registration for unregistered ECD programs identified during the Vangasali campaign, through which we have identified 52,185 ECD programs. Phase 2 of the campaign is currently underway, focusing on the massification of the registration of ECD centers. Despite the initial delays experienced with the processing of subsidies to this sector, I am pleased that the provinces have since transferred over 94% of subsidies, and the remainder will be processed before the end of the current financial year. And with regard to the transfer of ECD functions to the Department of Basic Education, we have set up various work streams advice in this process, and we will update you in due course. And I think that we have been asked this question before, and we did indicate that we are still committed to the announcement that was made by the President during SONA, but we're just really making sure that the technical aspect of it is done properly and we not found wanting along the way as we do the transfer. I also want to indicate and call on the ECDs, especially those that have not been registered. It will be very difficult for us as government to subsidize or support ECDs who are not registered and ECDs who cannot account for the support that they get from government. But it's not more than just accounting for the monies that are sent to them. It's about the impact of the work that they do when the children are in their care. On foster care, we We have made significant progress to implement the North Gauteng Court Order on foster care. The Social Assistance Bill was approved by the National Assembly in October 2020. Meanwhile, the Children's Amendment Bill was gazetted for public comment, and we hope that the public will be able to make their comments. And I call, actually, when we talk about public making comments, it's important for us to encourage those that are in our communities particularly to make the comments, because many a times the comments end up being made by those that have the means of making those comments. People can just organize themselves and make sure that they make the comments. And now we are doing things virtually also, so Parliament probably will open up the space for that. So the department must be able to make arrangements if they are virtual. I know there's written submissions, but also there can be oral submissions. These two pieces of legislation form part of the long-term legal solution to improve foster care system in South Africa. Provinces are implementing provincial recovery plans to clear foster care backlogs. We'll continue to work closely with Departments of Justice, Correctional Services and Home Affairs to address foster care challenges, as this requires multi-sectoral approach. On the issue of funding of NPOs, during the first and second quarters of this financial year, the portfolio experienced delays in relation to transfer of payments to NPOs. This was due to the lockdown regulations, confirmed cases of COVID-19 infections, and migration from bus to central supplier database. To address this, the National Department issued a circular to all provinces with proposed measures to ensure continuation of funding to organizations. The circular further advised that in instances where service legal agreements, SLAs, were not yet signed or finalized, it was suggested that provinces should extend the 2019 SLAs for 6 months until September in order to ease the transfer of first and second tranches of payments. The Western Cape, Northern Cape, Free State, Gauteng, Limpopo, Mpumalanga and KwaZulu-Natal provinces adopted the circular, and they have developed their circulars respectively. The non-payment and delays specifically for the first quarter payments were experienced in the Eastern Cape and the Western Province respectively, and we are continuing to work with each other because we really need to make sure that NPOs who are dependent on this are paid. To date, the first and second quarter delays have been cleared, with the exception of Northwest, which is still experiencing technicalities with the central supplier database. In the provinces, the 10% of NPOs which are not yet paid are mostly due to non-compliance. NPOs changing banking details and delays in submission of claims. Overall, provinces are on course with processing payments for the third quarter. And I do want to make this statement here. NPOs have the right to receive the payments, but NPOs also have got a responsibility. We cannot afford to be putting money to people who are not being accountable of the money that is being given to them. And we have also indicated that those NPOs who need assistance in terms of ensuring that they are trained, where they don't understand the criteria and everything of government, we are here to assist them with that. And I think that the NDA in particular is one of those institutions, which is our institution, that can help them. You see, accountability is a two-way process. Accountability is not by us, myself as a minister accounting, the CEOs and everybody accounting, and the other people who receive the money then think they shouldn't account. They must account. On food security, DSD portfolio witnessed a massive surge in the demand for food relief during the lockdown as people were stuck at home due to the disruption of the livelihoods and were not able to provide for themselves and their dependents. To address this, the portfolio has dispersed 1.4 million food parcels that benefited over 7.1 million people throughout the country. And we've been here already with regard to who supplied what, where, and how. And there are many lessons that were learned during this period, which we are going to be able to use to try and improve our system. We are also grateful for many corporate and charity organizations that partnered with us to ensure that no child or family goes to bed hungry during this period. Our center-based feeding program is now fully operational in all provinces and provides cooked meals to vulnerable individuals and households. We do, of course, still indicate that COVID-19 is not yet gone, and therefore, while people can be able to come for these cooked meals, we really have to be very careful, and the call again is for people to adhere to the protocols. And we do also indicate that as a portfolio, we are looking at the best ways of improving in terms of our services. Even this, we are having serious discussions around how else can we do it to make it better so that it's easily accessible to our people. On NPO registration and compliance, there was an increased demand for registration of NPOs between April and September. One can deduce that this demand was driven mainly by the surge in the demand for social services, especially in poor and vulnerable communities. During this period, we received 14,762 new applications for NPO registration. Of this number, 9,998 applications were processed, while 7,669 NPOs successfully registered. We intend to clear the backlog of NPOs registration by the end of the current financial year. With regard to compliance, I've already said that with compliance monitoring, we are also exploring the digitization of our service, with most NPOs now being able to submit annual reports online. And this issue of compliance really is a very big problem for us. I think if the CEO of NDA would speak to our disbursement of the CARA funds and how people are not now being compliant again or being accountable to that, we will not disburse any funds when people are not compliant. In fact, I think MECs, one of the things that we need to do, we do need to talk to our communities and see as to whether the service is worth the amount of money that we are disbursing, because we've got to see the value for the money that government is giving. On social grants, since the declaration of the state of national disaster in March, SASSA has without fail continued with the normal business of paying social grants without any major interruptions, including the implementation of the 6-month top-up grants that were announced by President Cyril Ramaphosa in April. We have commenced with payments for December to avoid overcrowding and long queues at the pay points. To date, more than 11.4 million beneficiaries have received their social grants to the tune of 15.5 billion. Between May and October, we allocated an additional financial support of over 11 million social grant recipients, and the amount spent was approximately 31 billion. And I know that there are many who are sitting at home now and saying, again, Anglo Minister, uyakhuluma uthi isasa isebenzile yenze kahle isibhadele thina sahleli la sikakayitholi imali yethu. We have made the commitment to say those that have not been able to receive their money, who qualified to get their money, we are working very hard to make sure that they get their money. We are also working very hard to make sure that we improve our system, especially when it comes to the payments that are made at the post office. We're trying to improve that. Processing of new disability grants. One of the challenges that SASSA faced during the lockdown periods relates to the processing of temporary disability grants, as face-to-face assessments and closure of some of the health facilities became a problem. With a view to lessen the administrative burden on beneficiaries, I extended the payment of temporary disability until the end of this month. About 210,000 temporary disability grants will lapse on 31st December 2020. We urge all those affected by the lapsing of this extension to promptly contact local SASSA offices for an assessment. Applicants are reminded to have a referral letter from the medical practitioner before they report to SASSA offices. SASSA is already working on a plan to ensure that those who need to reapply for the temporary disability grant are afforded the opportunity to do so. And with regard to special Special COVID-19 Social Relief of Distress, the Social Relief of Distress Grant, we have to date distributed 13.5 billion rand to more than 6 million eligible beneficiaries. As a portfolio, we are pleased with the government's decision to extend the provision of the grant for a further 3 months until January 2021. Of the 9.5 million applications processed in November, over 6.9 million applications were approved and are already paid. We are currently processing applications for December, and we intend to process payments before the last week of the month. Of these payments, SAPO accounts for 4 million, 1.6 million are paid through personal accounts, and 100,000 through the mobile money or cash send platform. There is still relatively small number of applications approved but not yet paid for the period between May and October. This is due to a number of issues, including information verification, banking details verification, while in other cases, SASSA is struggling to locate the applicants as the contact numbers used during the application are no longer in use. The remaining 1% of the outstanding applications will be processed for payment as soon as we have completed this. At this point, actually, SASSA CEO, I think we have to thank those people who have really been supportive and assisting those who were unable to do so. Utatu Vula, by the way.
Eastern Cape.
Utatu Vula, Eastern Cape. Utatu Vula yena uthatha eyakhe iphone. Aenzele for bonke abantu abalandelayo, and then when we are doing the verifications thola ukuthi cell phone yomuntu oyi-1, but again I talked to him over the phone because I like the fact that even though he got his money at the beginning of the month and then didn't get it the following month, Utatu Vula was able to say, Minister, ndinceda nabanye aba around him na because abana ma means. So that is what we want to encourage, but of course sometimes it becomes a nightmare for the system, because then the system doesn't recognize the number, doesn't recognize the ID and all that. But siyabulela to all those who were able to assist others. We are experiencing challenges with regard to a number of unclaimed benefits despite the fact that they have been approved. Currently, there are 40,584 unclaimed benefits, mainly from the cash send or mobile pay option. The majority of applicants who opted for this payment channel have failed the cell phone verification process, and this has raised questions regarding the compliance with RICA requirements. We have tried to reach out to these applicants with very little success, but we will not give up. When we say that we've not been able to reach them, doesn't mean that we will give up. We'll keep on trying, and with the help of volunteers also, Nabantu abafana noTatu Vula, I'm sure we can be able to trace. We therefore call on all applicants to collect their grants, as this is intended to assist them to meet their basic needs. On fraud and compliance management, we remain concerned by the large number of applicants who, despite their ineligibility, oh Jesus Christ, I guess Zulu, maybe knowingly apply for the special COVID-19 SRD grant to defraud the system. Over 3 million of such applicants were found to have other sources of income, including 7,482 who were found to be receiving social grants. 605,466 were registered for the UIF, and 168,920 received a NSFAS. A major concern is that over 8,000 applicants were found to be using the personal particulars of deceased persons. This is not only illegal but criminal. Thanks to our investment in fraud prevention and detention, we are now able to act speedily to deal with suspicious cases and fighting fraud by working with other government entities and law enforcement agencies. Let me hasten to add that we will be instituting recovery measures for persons who may have illegally received the grants meant for the most vulnerable. online grant applications, COVID-19 has sparked considerable shifts and has opened a new era of digitizing our services. One such area is the automation of grant applications, which SASSA is currently piloting. This will enable applicants to apply online without leaving the comfort of their homes. The initial pilot is limited to applications for grants for older persons, foster child care grant, and child support grants, with the disability-related grants being added as at a later stage. Once the necessary links of the medical assessments have been resolved, the pilot commenced in September and has been running for a period of 3 months, with checks and balances consistently being built into the system to ensure, first and foremost, the protection of personal information. This is the first of many initiatives in the pipeline. It is important that we do not forget the key lessons we learned as we adapt to the new normal. On residential facility care for older persons, drug treatment centers, shelters for survivors of gender-based violence and femicide, and child and youth care workers. The 16 days of activism for no violence against women and children ended yesterday. The department is implementing the 365-day program of action with focus on expanding prevention and expansion of services to ensure survivors receive timely and appropriate services to avoid secondary victimization. Department currently consolidating public inputs received for the Victim Support Service Bill, which advocates for a victim-centered approach. We recently launched also the Gender-Based Violence Command Center, which has been relocated to new and bigger premises. On average, the command center deals with more than 200 calls per day. The new premises will accommodate a workforce of 30 personnel and create opportunities for the recruitment and employment of social work professionals. On the rollout of a hashtag Asikulume and the Boys and Men Championing Change program, we focus on district development model. Expansion of Khuseleka one-stop centers in 6 provinces to ensure each has one that provides multi-sectoral approach to survivors of GBV to rebuild their lives and access justice. As part of the ongoing measures to implement Pillar 4 of the National Strategic Plan on GBV, the department, in partnership with NDA, has appointed 312 civil society organizations through the Criminal Assets Recovery Account funding. With regard to residential facilities for older persons, the department has forged partnership with private sector and civil society. We have also been able and continue to track and trace COVID-19 infections, recoveries, and deaths within our residential facilities. Interventions such as hospitalization, accessing medication, quarantine, procedures, among others, are monitored on an ongoing basis. Excuse me, I do need a... It's a bit hot. No, I don't need that. I need a tissue. Yeah. My apology, it's quite hot in here. With regard on secure care centers, all secure care centers are COVID-19 compliant and standard operating procedures were operationalized. Cases of children detained in secure centers on compulsory diversions are also carefully monitored, and we have visited some of these care centers ourselves. With regard to sentenced children, all efforts which were implemented prior to lockdown, such as early release of those eligible, are cautiously being implemented. This is to ensure the promotion of individualized response, which strikes a balance between the circumstances of the child, the nature of the offense, and the interest of society. On substance abuse, South Africans generally overindulge in alcohol and illicit substances during the time of this year than any other time. We are concerned about how this phenomenon, as we are in the midst of the global pandemic that thrives when we let our guards down. Such behaviors are likely to contribute to the new surge of COVID-19 infections and gender-based violence and femicide. To address this, we are conducting the annual anti-substance abuse festive campaign. By the way, festive campaigns, we cannot have them in the same way that we're having the festive campaigns. We've got to use a different way, focusing on COVID-19 and GBVF hotspots throughout the country. The national campaign is aimed at educating the country's citizens, especially young people, about the dangers and adverse effects of alcohol and substance abuse. The campaign will be launched in Tlokwe, Northwest, tomorrow during the official opening of the JB Max Treatment Center, which will bring the total number of public treatment centers to 13, with at least one in each province. Given the devastating impact of alcohol on families, we support measures proposed in the amendment of the Liquor Act 2003, amongst others, restrictions of advertising, marketing, promoting and sponsorship of alcohol beverages. We also support proposals for the setup of special fund to which the liquor industry will contribute a percentage of their net profits towards prevention and harm reduction, as well as further reduction of alcohol levels for drink and driving to 0.02%. On creating jobs and economic opportunities, the outbreak of COVID-19 pandemic occurred at the time our country was in recession. If there is a silver lining about this pandemic, it is that it has forced us to think outside of the box and to find innovative ways to maximize the impact of our work and align it with the district development model. The NDA set aside 32 million for 200 civil society organizations, including cooperatives, to stimulate local economic development through the procurement of PPE and recruitment of volunteers at district municipalities. I think that the DA today gave us masks that have been made, I suppose, by a cooperative somewhere or a small business. NDA, yes. But also the department yesterday gave us T-shirts, and it was quite exciting that I saw that the T-shirts were not made somewhere else, where I always complain about. So we have local production, even if it comes from Lesotho in the neighboring countries, it's okay, the money is still remaining within the region. This initiative has far surpassed our expectation, as it created 2,000 job opportunities and gave our youth, who are hardest hit by the current high levels of unemployment, opportunities to contribute to the communities while improving the livelihoods of their families. Looking at the number of volunteers, I can safely say that more than 10,000 family members benefited indirectly from the stipends. To date, a total of 6.1 million has been paid to participating CSOs and volunteers. 8 of these volunteers in OR Tambo districts were given 4 to 6 months temporary contracts as social work under Victim Empowerment Program in the department and are receiving a stipend of about 6,000 a month. The volunteers comprised of 1,600 women and 400 men. Youth made the largest number at 1,750. To date, the program has reached 181,171 households, distributed 73,581 food parcels, and assisted 147,289,000 to apply for special COVID-19 SRD grant. In addition, the NDA availed economic opportunities to 16 women-owned cooperatives across all provinces to produce the PPEs to the value of 1.1 million for the volunteers. Persons, facilities, the visitations are prohibited except for relatives and under strict COVID-19 protocols. New admissions will only be considered for older persons in distress, subject to strict adherence to COVID-19 protocols. We have partnered with the National Institute of Communicable Diseases, NICD, and will continue to track and trace the COVID-19 infections within residential facilities. We take this opportunity to acknowledge the generous support of our partners to ensure that our older persons are protected from this deadly pandemic. And on adoption and international social services, I'd like to inform the public that we will continue to render domestic and national adoption services. However, the suspension of international adoption services will remain in effect until further notice. The full impact of COVID-19 pandemic on our society and all our sectors in particular is still emerging, but what is certain is that it will be felt for many years to come. The increase in unemployment, homelessness, gender-based violence and femicide, and concerns of the impact of the prolonged pandemic on mental health are some of the key emerging issues that threaten to exacerbate some of the prevailing social ills in our country. And the issue of mental illness, I think, is one that we need to really focus on. As an impact of this pandemic spread across our country, the capacity of DSD portfolio to respond to match the full scale of the challenges, especially in protecting those most in need, will continue to be tested. This presents us with an opportunity to learn new ways of doing things and to reimagine the DSD portfolio. The last 6 months have been a learning curve for all of us, but we have demonstrated how much more we can achieve when we work together. Thank you very much.
Thank you very much, Honourable Minister, for those inputs. We will now take questions, and how we will do it, we will take 4 questions at a time. We'll do 2 rounds. So we'll start with the questions that are online. If we can have the first 4 questions, we will direct them accordingly. Let me just confirm. So members of the media, please do indicate who you'd like to direct your questions to. Currently in the room, we have the MEC of Social Development of Limpopo, Ms. Karaneng Rahwale, the MEC of Social Development of the Northern Cape, Ms. Ntombela Vilagazi, and the MEC of Social Development of the Northwest, Ms. Boitumelo Umuelowa. So those are the MECs that are currently here. The HODs are here from the other departments and we'll be able to take those as well. Okay, can we have the first round of questions? We'll take 4. If you could read them, please. You could read them. Okay. So there are mics on the tables because of COVID. You could just press those mics and then go through.
Hi, good morning, Minister and your team. It's Kylie Kumale here from ENCA. So, Minister, with regards to the special COVID-19 grant, so you said you have done a very sterling job in terms of the payment, but also I just want to understand in terms of the applicants that haven't been. Do you have any estimates, just in terms of the actual payment and just in terms of the arrest, as part of your anti-corruption plan? How far are you with cracking down on those who have stolen essentially from the states? Thank you.
Thank you very much, Kailile. Do we have any more questions in the House? There's one at the back. Please introduce yourself as well and the media house that you're from.
My name is Malungelo Boy from Newsroom Africa. Minister, you spoke about those 40...
We didn't get who's speaking?
Malungelo Boy from Newsroom Africa.
My name is Malungelo.
Okay.
Which... Okay. My name is Malungelo Boy from Newsroom Africa. Minister, you spoke about those 40,000 of those grants that were approved that you you have not been able to sort of like locate the people. So what happens then to that money? Does it stay there? What is there an effort that's made to find those people? And you spoke about recovering money from those that have in fact defrauded the system. Have you started with that process already? Thank you.
Thank you very much, Malungelo. Do you have any more questions internally? Okay, can we take 3 online?
We don't have any online.
It means the remarks were spot on, Minister. Okay.
I can't believe that.
Okay. Minister, if you would.
I think I can ask
allow the CEO.
The CEO to. I can ask the CEO to give the data, because she's got all the data, and also what we have to do to try and trace the people who have not been paid.
Actually, we touched on that.
Yeah, I did. We did. Yes.
Sanibonani emakhaya, sanibonani nabakhona like la endlini. I thought it was important first to just respond to the issues from Khayelihle and Malungelo on the applicants that were not paid. We have actually given all the names of the people that we have not been able to trace to the regions, so that the regions can actually go and get and find the people in the different areas. It's important to highlight that some of the people that have not been paid, that have not gone to get their money, some of the money is actually at the post office. We've sent people a number of SMSs, and they have not gone to get their money. At the end of the financial period, because we need to make sure that we're able to account back to National Treasury, we'll then engage as to what is it that needs to be done. But if the money is not taken until the end of the financial year, we'll consult with the Minister and take a view as to what should happen, because as we know, the money is supposed to be given to the individuals for what is the current situation to address the COVID challenges that they are currently experiencing. The other people that we found is that with those people that actually already have post office accounts that did not declare that they have those accounts to us, it's difficult for the post office to open yet another account. That's why they continue to get rejected. So we'll continue to make all endeavors to make sure that those people that have not received their money, one, we track and trace them, and when we find them, we can ensure that they get their money, and those that for whom we are still battling with regards to the accounts, once the regions have found them, we can make sure that they get paid. On the issue of the people that have fraudulently applied for grants, that some of whom I want to believe that they should have known that they did not qualify for the grant, because we indicated upfront as to what is the qualification criteria. Those people that are working for government, few as they may be, we were writing to all their departments so that, one, we can ensure that we can get the money back, but over and above that their departments can then start internal procedures in terms of ensuring that consequence management is applied in relation to those particular ones that are working for government, just as we've seen with what has happened in City of Johannesburg. They've already started processes in relation to that. The intention is also to try and get data from all the other local government structures, because much as we've got information from City of Johannesburg, we don't have the other information, and we'll continue to check as to who are the people that got money that were not eligible for the money. We've found a number of people that have been found to have committed other other frauds in other environments, because we work with a whole range of other institutions in the country that investigate these. We found, for example, that there's people whose IDs have been involved in fraudulent activities, or cell phones that have been involved in fraudulent activities. We found about 42,000 of those people. We're going to reconfirm again to say, are you certain that much as you may have, because some of the people may have gone to jail and came back from jail, that we need a double confirmation before we can actually pay them. Those are the people that we've actually handed over to the Fusion Center, because, as we know, we work with other law enforcement agencies to make sure that we're not on our own in terms of managing this. The other key area that I think I need to clarify is the issue of those people that have made appeals. We have to date about 300,000 appeals from what we have found on the system. We know that issues have been raised about the number of people that are actually dealing with appeals. The fact that at head office we've got only 10 people, and in the regions we have another 42,000 that are dealing with this. It's because this is a digital platform. The only thing that the people at head office are doing manually is just sorting out the emails and making sure that the people that have made the appeals go to the correct queue. Subsequent to that, it then becomes a digital process. That's why we don't necessarily need to throw people at the problem and can use a different process to make sure that we assess that. I know that it's been raised like it's because we're not dealing with it. But we are, because this is important. And the other issue is that on a continuous basis, we actually validate each and every client to make sure that they are not, we don't have exclusion errors. The one issue that could have caused exclusion errors could be the fact that we did not in the past have updated database, for example, from UIF, which we now have. We've been working together with the commissioner to make sure that we get a much cleaner database so that we can validate all the people that have made appeals so that we can make sure that they get their money. The other people that had actually not received money also are those people that are with UIF. We've since sent the database to UIF so that we can ensure that UIF can validate them. We've received already back 2,700 clients that UIF has validated and ensured that they didn't qualify. The only data that we're not going to use is the SARS database, because one should be either within SARS or within UIF, so we'll only use UIF to ensure that we re-qualify the people that may not have qualified. So ngifuna ukucela ngithembise kulabo asebafakile izicelo zokuaphila ukuthi sizowaprocessa wonke lama application wawo. I-application yokugcina esizoyi-accepta ye-appeal izoba ngo-15 zaka February, ngoba ngokomthetho owabekwa uminisa ukuthi mangabe sesicedile ukuprocessa i-application, ngoba naku sesikhathi sathi i-grant izoqhubeka igcine ngoJanuary, kusho ukuthi mangabe uwenze i-appeal yakho, ngikhuluma ngalabo abazawube ba-apply ngoJanuary, i-appeal yabo sizoyibheka until nge-15 zaka February. Yiko sisho ukuthi sicabanga ukuthi sizabe siqedile ukwenza wonke umsebenzi, sikline i-system by the end of February, so that ngoMarch sikwazi ukuthi sireporte ku-President through uMinister ukuthi yini esikwenzile kukuphi la kushota khona. Ngiyabonga kakhulu.
No, so this way sanitize.
Thank you very much, CEO.
I'm not sure if any of the MECs would want to say something, because we just happen to be lucky. We came here waiting for long, many questions. So if any one of them would like to say something.
Yes, I'd like to invite the MECs if they would like to say,
if anyone
to
of
add,
them
please.
Want to add. or something.
MEC Northern Cape, Northwest, and
Say something on Kara
Limpopo.
as well. And then we can also ask NDA to speak to the issue of the Kara funds.
Okay.
Yeah.
The minister was able to cover us.
Okay. Thank you very much, CEOs. Are there any more questions that have popped in?
No, please
online?
don't ask for more questions. If they are not there, they are not there.
Okay.
Thank you, Minister. Good morning, MECs, colleagues, media colleagues. Mine is to explain briefly on CARA, which is a criminal asset recovery account, which is implemented by National Development Agency. Like Minister Obega explained, these are funds that are given to CSOs and NGOs and NPOs that are dealing with gender-based violence in the country. In the 168 that we have given, the first tranche, what we are experiencing is the challenge of reporting. Some, because they are still emerging, they are funded for the first time, they've been doing good work. However, because of the tight controls that we have, because these funds are linked to CARA funds, are linked to COVID-19 funds, if I can put it like that. So we had to make sure that our internal controls are tight. The struggle that they have is that the work is done on the ground. When they report, we don't take the report on the face value. We take the report, we go back to the civil society, we go back to the beneficiaries, which is the community, and we evaluate. The gap that has been there is that it's either they report outside what they contracted on, or they don't know how to report at all. So we don't penalize them. As National Development Agency, our role is to capacitate them, is to empower them. So the delay is that, however, those who are well established, they've been doing business for some time and making these programs for some time. We've received, from 168, we have received only 24 up to now. So only once we receive all we don't penalize those who submitted on time, but we just make sure that we do our quality check, our due diligence, and then we give them their second tranche. However, it is a concern that the gap from those who are well established and those who are still emerging, yet the gender-based violence is in the deep rural areas, is in the township, is in the semi-rural areas. It is a concern for NDA to strengthen the capacity building, to work closer with social workers. And I'm happy to say, Minister, social workers that have been in the Eastern Cape that have been working with us through this CARA, some have been absorbed as well as social workers to social development to do this work. So those who have been trained by social development in the past and were never employed by the Department of Social Development through the CARA program, we prioritize that they come through to assist the NGOs, and we'll be embarking on the program now going forward to ensure that for the second tranche that is there, all these cross the T's and the I's, we make sure that they are there. But we want to really appreciate the hard work they do, the hard work that they've done during lockdown to make sure that they take care of our communities, especially those in rural areas. They are doing a sterling work. We really want to appreciate, but we won't compromise on monitoring and evaluation. However, we won't penalize you. We will empower you, we will capacitate you until you are fit to give quality reports that we require to account. Thank you.
I can see camera. Okay. No, let me just do 2 I think I wish to thank the MECs for taking time to be here. From here, we are going to now engage on our normal MINMEC meeting, where we have to look at the things that we're talking about here and what we're going to be doing during this period of COVID-19. During the December period, I think it's going to be a hectic period for us, whether we like it or not. And so we have to just go and engage on what plans do we have at a national level, at a provincial level. And I know that okubuhlungu kakhulu is this whole issue of gender-based violence, the killing of women and children. Siyacela bakithi, siyacela bakwethu. If we can just, as communities, mobilize and know what is happening next door, know your neighbors. If you hear any cries, please do not close your ears and your eyes. If you know that something is happening next door, and uyazi ukuthi umama walapha ekhaya into ayaziyo yisibhaqo, sicela ukuthi uyeke ukuthula ngoba uyazi ukuthi kusasa kuzobe kukhala wena lapha seliphuma ibhokisi lalowo muntu loyo eseyongcwatshwa. So kubhlungu nje ukuthi sikhulume ngento efana nale, but unfortunately for us, we have to talk about it and we have to mobilize our communities. Also is to say, kubantu bakithi, as we go out and enjoy the festive season, it will not be the same. Families are not going to be enjoying it the same way. Re kopa gore di family le tsone, batswadi, di neighbor and everybody, re kopa gore le bone gore ko next door wetsahalang. It's not interfering gore wetsahalang ko next door. How there's a scream or there's a cry, please do not close your ears and your eyes. Help us end the scourge against violence against women and children. But also, I'd like to thank my colleagues who we have been working with, in particular with regard to the issue of gender-based violence, the Department of Women, Youth and People with Disability, the Department of Justice and the Department of Police. And thank the men in blue and the women in blue who, despite all the challenges, they really are going out there and doing the best that they can. Please let us not rubbish them, because they are also just human beings. They need to be supported, they need to be assisted, because they usually are the first people to come across a crime scene, which in many instances is very brutal crime scene. So let's support each other. But more than anything else, I'd like to thank the DSD family, the DSD portfolio. I don't work alone. And you guys must always understand, when we call you non-stop and we are questioning and demanding, it is simply because we don't, as MECs, work alone. We work with the department. So the HODs, and the DGGs, the DG, and everybody is very important to us. And as I've said in the beginning, be safe yourself before you think you can save others. We lost too many, even among us, especially SASSA. I think SASSA is the one that was hard hit. We've lost a lot. And to the families who are part of our families, we are sorry that this happened. COVID-19 is real. Can everybody just really try their best to stick to the COVID protocols? Thank you. And to the media, by the way, you guys, thank you very much. We shouldn't forget that you are out there and you are assisting us in the communication and in ensuring that people understand and appreciate what we do as government. Sengphuma nje laba abasinikeze o4 no 3 no 2 no 1 nani siyanibonga ngoba kusho ukuthi khona la nihleli khona niyas analyze nisenza yonke le nto le. It's okay, this is democracy, we fought for it, we building the democracy. So siyababonga o5 no 4 no 3 beni.
Thank you very much, Minister. I won't go into the numbers. I think you've said it all. Ladies and gentlemen, this brings us to the end of our media briefing. Thank you very much for being part of it. We'll ask the MECs and the Minister to kindly take leave at this time before everybody else does. Thank you very much.
Yeah, ukuthi sibakhiphe ngalamu.
I know. So I need to. Actually, we must make this.
What time is this now? The one that I'm talking about is the mystery. I just want to know if you're still going to be around.
No, we'll be back.
I'm supposed to go to bed at 12.